Hi, my name is Kausamba Sela, and I'd like to welcome you to this special interview for the Center for Trade Policy and Development, working in collaboration with Save the Children on a particularly special project. Now, the sensitivity of the National Health Insurance Scheme to child health needs is what we'll be discussing, but as an introduction to that, the Center for Trade Policy and Development, CTPD, in partnership with Save the Children, SCI, for the past 3 years has been working on a project focusing on public investment in children. The project seeks to influence the devotion of more resources towards public investment in children in Zambia. Now, as part of its work, CTPD recently conducted a study that sought to understand how sensitive the National Health Insurance Scheme is to child health needs. In the context of health, organizations such as Save the Children have recommended a rights-based approach in order to secure the health needs of children. Unlike adults, health issues for children's rights to basic health care services within the healthcare system, such is necessary to define an essential package of healthcare services for children in order to determine what they are entitled to and what the government or the state should be accountable for. Without a defined package, there is a danger that the drive for efficiencies and cost saving may result in a limited basket of care that doesn't address the complex needs of children. The essential package for care of the child's rights to be supported by a set of norms and standards. These need to specify the infrastructure, the equipment, medicines, and staff needed to meet the unique needs of children. Now, joining me here in studio is CTPD Head of Research and Legal, CTPD Head of Research and Legal. This is researcher Chileshe Mange, to discuss the sensitivity of the National Health Insurance Scheme to the health needs of children. Now, this material production has been financed by the government of Sweden under the Civil Society Strengthening Project in Zambia. Responsibility for the content lies entirely with the creators, that's SIDA, and does not necessarily share the expressed views and or interpretations. Hi.
Hi.
It's been a while since we had a discussion.
Yes, it has. It's nice to be back.
How have you been since then?
I've been well, thank you. We're keeping alive, staying healthy.
Okay. Tell us about, first of all, CTPD.
So CTPD essentially is an economic think tank, and the core of our mandate is to advocate and develop pro-poor policies insofar as they relate to issues around the economy, so whether it's extractives, trade and development, and public finance. So really that's the core of our, that's our core mandate. And the backbone of the CTPD is, of course, our research. So we generate empirical evidence, and through that we seek to then inform policies and then advocate for specific policies to be implemented.
Okay, so when you say research, research specifically for who?
As the need arises. So we have several partners, and as I mentioned, operationally we have specific desks within the research wing. So we have an extractors desk, we have public finance desk, we have a trade desk. The trade desk at the moment is mainly anchored on agricultural sector, but isn't limited just to agriculture, other areas of trade and development as well. Then we also now have a legal desk which looks specifically at legal issues and advocating for legislative reform. So that's how we operate in these four main areas. So basically all sectors of the economy, and then we respond to specific issues as and when the need arises, or we may have predetermined issues that we would like to interrogate.
Okay. What is the background of the National Health Insurance Scheme, since this is what we're discussing?
So it's been on the government's agenda for some time now to provide universal health care to Zambians. So the National Health Insurance Scheme is really a realization of that goal. So what it is in 2018 the government enacted or passed a law, which is the National Health Insurance Act, which established the National Health Insurance Scheme. So essentially every Zambian below the age of 65 and above the age of 18 who's able to contribute to the economy or who is employed or self-employed is required to remit at least 1% of their earnings, and then the employer a separate 1%. So collectively we're contributing about 2% of our earnings, monthly earnings, to this scheme. The idea being that going forward we will have universal health care, free access to free health care, public and private. So it's meant to really make sure that we reach that goal of universal health care.
Is it possible?
Well, yes, it's done in many other countries. I don't see why we should be the exception. And like I said, it's been on the agenda of the government for some time now. And when we say is it possible, well, it's being implemented as we speak. So, of course, it's still very early days. I'm sure there are lots of teething problems. But as far as the law goes and as far as what's happening on the ground, it is being implemented right now.
Yeah, I asked that question based on the fact that you're a think tank and you obviously know the size of our economy and what it might cost to, get to a point, the desired point. So, yeah, have you made any projections as to when this could be properly feasible in terms of, access to health for all?
I think we haven't made projections per se.
Okay.
I think the question now is to see, as it's being rolled out, at which point we actually have a smooth system and we come to that point of realization. So the way that it's being implemented is through what they've termed a benefits package. So within the NHIS, you have what they call the National Health Insurance Management Authority, NEMA, which is the entity tasked to actually manage the health insurance scheme. And that management authority, NEMA, also then manages the National Health Insurance Scheme Fund, which is the monies that we're all remitting. They have designed what they call a benefits package. So this benefits package essentially outlines the services that are available to the public at specific public and private institutions, health institutions. So by accredited, they mean that particular institutions are supposed to be accredited or identified as institutions that are fully compliant with NHIS. You and I should then be able to go to the institutions and get the health care that we need. So be it UTH, be it, for example, just speaking random example, say CFP, for instance. If it's accredited, we should be able to go there and get our health care and then also get our medication for free from a particular pharmacy and so forth. So what remains to be seen at this point in time is how long it will take us to get to the point where it's fully operational.
And also, I know it's law now, but I don't know if you've actually had research in this particular area, but the aspect of compliance from the point of employers, how much of that is, being done, or how little of it is actually the reality?
So let's keep in mind that the benefits package was only published in 2020. This year, 2020, in January. So it hasn't even been a full year yet. So we're yet to see a report from an auditor's report of any kind for us to actually fully understand how compliant have employers been, how much money has gone into the NHIS in the past year. These are all things that are yet to be seen. And like I said, to be fair, it's been just under a year of implementation. So these reports are yet to be published or made available to us.
Okay, so speaking of NHIS, in regards to the benefits package, how do you see this, being implemented for, the provision of, health services for the children?
Okay, so when we speak of child sensitivity, this essentially speaks to a range of policies or strategies that specifically target child health needs. So without a doubt, the health needs of children vary from those of adults. There's particular issues that have to be addressed in the continuum of care. So what we were looking at is to analyze exactly to what extent is the National Health Insurance Scheme, or the benefits package itself, sensitive specifically to child health needs. So what you're looking for here is to see number one, is there a separate financing allocated specifically to children? Number two, do we have specific services that are separate from adult services meant specifically for children? So these are the kind of things that we were trying to look at and understand. What we found is that the benefits package does outline specific services that are available for children, but doesn't necessarily outline the implementation thereof. So, for example, we have not found that there is a specific allocation within the fund which goes towards children. We have not found that there is specific services that are, or a specific system within the system which deals with children's needs. That's what we did find. But again, like we say, it's been less than a year of implementation. I think that these are possible teething issues that could be addressed later on.
But has there been, excuse me, from your findings, any policy document to advise on rectifying these, what you'd call lacunas?
No, not necessarily, but let's keep in mind that even prior to the NHIS, we already have in place quite a few policy documents, whether it's the National Development Plan, whether it's the National Health Strategic Plan. We have documents from UNICEF, documents from the World Bank. So several documents, several policies already that are in place, or that we have at least assented to, that deal with child rights and how children's needs should be addressed. So we do have already within the framework several policy documents, even prior to the NHIS implementation. What this was looking at specifically is within the NHIS, is there a specific sensitivity towards child needs?
And so when you bring up the issue of sensitivity, a layperson may say, what is meant by child sensitivity and why is it important, even for the children themselves?
Okay. So when we think about the development of a child, it has to be holistic. And we have to remember that Zambia is a low-income country and with very, very high poverty levels. So you find that in order for you to have a productive adult population, you must address specific needs as children are growing up. So access to health, access to education. These bear an impact on how productive they are and move into the labor force later on. So you find that issues around, for example, immunization, access to clinics, these are all factors, malnutrition, diarrhea, these are all very specific issues that address or that affect children. So if you don't deal with them, if you don't deal with child health needs within continuum of care, you find that you will not have a productive workforce going forward. That's why it's particularly important. So you must have specific policies in place that address the child health or child needs, health, education, various issues within the social protection scheme.
So as we, at this juncture, do you feel comfortable with what's obtaining on the ground? Research-based, of course, findings.
So if we're going to limit ourselves to the National Health Insurance Scheme, the answer would be, well, we're yet to see. Our findings are that, like I said, we're not clear about a specific fund that is targeting specifically child health needs. We're not clear about a specific system within the system which deals with child health issues. The benefits package does outline what services are available for children, but how those are then put forward is a different story. So for instance, if you go to a hospital as an adult and as a child, it starts competing with you as the adult for the same access. Those are issues that on the ground we need to, we have not yet seen a deliberate, shall we say, a deliberate strategy in that regard.
Okay. You answer my next question in advance, which was going to be, does the current National Health Insurance Scheme framework respond to the child's needs specifically? And you've answered that quite competently. But can you comment on, for example, because we've seen how COVID has affected the economy, has affected several adults and the likes, but how COVID-19 has had an effect even on the National Health Insurance Scheme in terms of its implementation?
I think the answer there would have to be a resounding yes. I think that with the advent of COVID, I think the entire health system sort of navigated towards or gravitated towards dealing with the COVID issue, so that other issues were sort of not put on hold, but the focus really became around COVID. So I would like to believe that the COVID issue has had an impact on how it's on the implementation even of the National Health Insurance Scheme, because that took priority over everything else. So it would be naive to say that it has not been affected by the COVID-19 issues. And like I said, it's been literally less than a year of implementation. So what we are very keen to see, and what we're watching very keenly, is going forward exactly how this is implemented. We did see publications recently where National Health Insurance, or NEMA rather, published a list of specific institutions that are now accredited, where people are supposed to be able to go and access free healthcare and free medication and all of that.
Okay. How can the implementation of the National Health Insurance Scheme be improved to address the health needs of a child?
I think primarily it would be ideal to have a fund which is directed specifically at child health needs. So procurement for equipment and for whether it's pediatric units or whatever the case may be. But we would like to see a fund that, or rather an allocation within the fund that goes towards child health needs. And then, of course, a system within the system, as I keep saying, which addresses specifically the child health needs.
Now, the health needs of children in rural areas vary from those in urban areas. Those in urban areas have a little bit more access to these health institutions and the likes. We did see government, bring about the intention of constructing 620 health posts countrywide. How far do you think that the National Health Insurance Scheme will help improve access to health facilities for the rural child?
That's a good question. It comes down to management of the fund and prioritizing where and how money is spent. So if 2% of my earnings are going towards healthcare, I should be entitled to to specific or a certain quality of care. So I should walk into a hospital, be able to get the best possible doctor, be able to have access to medication for free, have surgery for free, whatever it may be that I need should be available to me. But we also have to look at issues around procurement of medicine, beds, all of those things. So what we're yet to see is, again, how exactly the expenditure has been of monies that have been collected and remitted. So yes, in an ideal world, there should be better access to even for rural hospitals, because there's no segregation between urban and rural. Everybody who's a child should be seen as an equal. So you would expect that even the rural child would have at least a close to similar service as that of the urban child. The main issue for those rural areas, of course, being limited access to health centers.
Okay. Excuse me. So two things come to mind even as we discuss this. First of all, there is the issue of the ratio doctor to patient, or is it patient to doctor? Also the aspect of nurses. So you find one doctor having to maybe take care of 1,000 people and so on and so forth. But also another thing would be how many people are employed in the rural areas as opposed to, or in comparison with, those in urban areas. So if we were to decentralize it, the revenue collection in rural areas would be less than that in the urban areas, and therefore perhaps much more improved healthcare systems in the urban areas, and maybe less so, if you want to use that argument. But also even just the aspect of, the ratio of the doctors and the patients. I do not know how far, you would have to go, because you're a think tank, in regards to advising on, matters such as these.
So, firstly, when we deal with infrastructure projects, which when you talk about constructing health centers, it's about infrastructure. So, of course, you have to ask the question of how productive is it to build health centers without critical mass? As you say, there's no point building one of these, but you don't have the masses to actually take out. You don't have enough doctor-patient, or the doctor-patient ratio is too wide for you to actually see a difference. So that is very important. But by its very nature, this is a social sort of system. If you were to label it, it's definitely not neoliberal policy. This is very socialist, and by its very nature, it means that you and I are subsidizing the poorest people, and I don't see anything wrong with that per se, because we do have a high Gini coefficient, we do have a huge gap between rich and poor, and you do have to sort of create an equalizer, and if this is how that is done, then so be it. So which is why I said earlier, what you'd want to see then is exactly how these monies that we're remitting are being spent, where are the priorities in terms of what is then procured. Are they going to channel money into developing rural areas, rural centers? So in what way will these funds that we're remitting be used? That's also something which we need to see. I think that once we have some sort of report or feedback from NHIS or from NEMA rather, after some time of implementation, we can have these particular answers.
Okay, so tell me this one thing. What is it that absolutely satisfies you about the fact that we have a national health insurance scheme in the country as law?
I think, to be fair, I agree with the principle.
Right.
I fully agree with the principle
Okay.
and what it is trying to achieve. I will be happy when I see the results of that principle, and if it speaks to what was the intention in the beginning. The spirit of this was to have universal health care. And by universal health care, we don't just mean, oh, I can go to UTH. It means quality health care.
Yeah.
And like I said, if I have a particular need, say I need surgery for God knows what, I should be able to walk into, whether it's Care for Business or Fairview, whichever place that may be, or an institution of my choice, really, and be able to get that kind of service because I'm actually paying for it every month. Otherwise, it's simply a way of overtaxing an already overtaxed what you call
Workforce.
it, a workforce or tax base. Yes, exactly. So we would want to see the benefits, for sure, of this initiative. But in principle, it's a very good idea.
Yeah, again, you're getting ahead of me, and perhaps I need to charge you or even sue you because you're more from the legal fraternity. I was going to ask, because you say, I like the principle, I agree with this, it sounded a bit more to me like there are, underlings of skepticism. And I wanted to, ask you what, I think you interact with enough people to have picked up, some of these skepticism. I'd like to, begin to understand what I would be skeptical about regarding the National Health Insurance Scheme.
Yeah. So the skepticism really would arise from accountability and transparency. And I don't want to say a lack thereof, but you would want to see that. So we haven't always gotten answers from the government in terms of how revenue is spent. I'll give an example of the toll fees, for example. We are yet to understand exactly how our toll fees or how the revenue from there is being spent. If we're saying that we have had to contract debt to build roads and so forth, but then to what extent are the toll gates or the revenue from the toll fees maintaining those or contributing to the building of of these roads? So the same thing would apply even to the National Health Insurance Scheme. It's money which we're remitting as citizens. So we would want to know exactly how it is being spent. So I think any skepticism would arise from that kind of the history. So we want to understand and know. We want more accountability. In other words, to say where the monies have gone, how it's been prioritized, how it's being spent, how much was collected. That is something which we haven't seen all the time. And I gave an example already of the toll fees.
Yes.
So we're hoping that, of course, with the Ministry of Health, in particular, there will be a different approach.
So for 3 years, you, City PD, and Save the Children have, been working on these particular projects on public investment in children, why do you necessarily feel the need to prioritize this particular undertaking?
The health issue or
There's just
public
public investment in
spending
children.
So when you look at public investment in children, you're looking at two main sectors, and that being those being education and health. And really, those are the backbone of your Human Development Index. So that's why that's very important. If not educating people, where are you heading in terms of future economic productivity? And if you don't have a healthy population, also where are you heading in terms of economic productivity in a few years down the line? That's why that's very important. Also, public spending, in terms of public spending, education and health are a considerable amount of, or take up a considerable chunk of the budget, ideally.
Yeah.
So also a question of understanding or being able to track how that revenue is spent, if at all it is being spent appropriately and going to the right sectors and for the right priority issues.
Okay, so bearing this in mind, and because you bring in the budgetary aspects, allocation-wise, following up on this particular project, are you happy with, the budgetary allocation for children's education, kindergarten, primary, and so on, as well as issues to do with health?
Okay. So I'm yet to see a breakdown of the allocations to the specific sectors within or the specific areas
System within the system. I'll
yes.
pick that one up.
So, so we know how much is going to health, we know how much going to education.
Yeah.
What we don't know specifically is how much goes to, say, general education, how much going to higher education, how much going to those different sectors. That much I cannot speak to right now.
And that's problematic, isn't it? If you're going to try and interrogate this particular matter.
Oh yes, it is. It can be. One of the studies we're conducting at the moment is trying to track the expenditure on education, and it's been a bit difficult to even get statistics and information or data from Ministry of General Education, for instance. And I'm going on record when I say this.
Yeah.
So that can be problematic for us to actually know exactly where things are going. But overall, what I will say is that in terms of the budget of 2021, would have definitely liked to see, say, less money go to defense and more go into education and health, for instance. So I think that we are some way away from attaining, say, the Abuja Declaration, which I think stipulates that you have to, I don't want to say the number, I'm not 100% sure, but you're supposed to have a particular percentage of your budget going towards health.
Yeah, I think 20%, I think.
Somewhere there.
In that region.
So we're not even there yet at the moment. So these are all things that, I think should be addressed at some point.
Okay, so also just still in the context of health, you have recommended a rights-based approach in order to secure health needs of children. Can you speak more towards perhaps some of the policy documents or, suggestions that you've made to this effect?
So we have made suggestions specifically on the NHIS itself. And so when we speak of a rights-based approach, you're talking about looking at what are the universal rights that children have, right to live, right to all of those universal rights. And so looking at policies that address the needs of children from that angle, from their legal rights, from their universal rights. So when we were analyzing this, we also tried to be consistent with that particular issue, which is why we're saying that we would have liked to see segregated system within the system, which deals with children's rights, children's needs specifically, because in so doing, you're then addressing their specific rights, the education, healthcare, free water, or clean water rather, immunization. These are all things that children should have a right to. Safety, you name it, security, all of those issues.
I don't admire the research component of what you're doing because, first of all, there is, for me, who is in the media, what I am crying for, which is access to information as a law, which we do not have still, and that, pretty much hinders how much access to information I have, even when I'm doing an investigative report. But Based still on this, the fact that Zambia's human rights record isn't as impressive as we would want it to be. I just imagine how much more impacting this is for the children, because even for the adults, they do not have as much access to things as per right. I can only imagine how much that also just impacts on the children.
Well, yes and no. Yes, because I think that universally you have human rights. Whether you're 5 years old or 27 years old, there are particular human rights. But then I think that there's also a deliberate, shall we say,
system within the
system.
system.
So universally we
that.
have very deliberate policies, very deliberate conventions or legal instruments that address the needs of children. And I think that in any society you find that there is always some sort of mechanism that deals specifically with children. So yes, we may say that we have a not so impressive human rights record, but I think that we do have the policies and the framework here in Zambia. I think one thing we should always bear in mind is that we are not lacking in terms of policies themselves. We tend to write pretty good documentation. We tend to ratify all the important international instruments, and you name it. It's really more about the implementation. That's usually where we see the gap. So in as far as addressing child rights and child needs, I think that the intention is always there. How that then translates on the ground is where the problem usually lies.
So as a think tank, also playing the advisory role, you have, I think, unpacked the fact that without a defined package, there's a danger that the drive for, efficiencies and cost saving may, result in a limited basket of care that doesn't address the complex, and this is the word that I picked, the complex needs of children. These gaps, and again, as a think tank, one, and then, as an advisor, if you allow me to use that, how much are you, if I may, pushing government to, just, what, this is what we have found, this has got to be done, get to work, do it.
So we have a very aggressive and a very well-established advocacy unit within the Center for Trade Policy and Development. The idea being that whatever we generate has to actually see the light of day. So we advocate constantly as CSOs. And one of the ways we do that is by partnering with people like Save the Children and other organizations that are also keen on seeing this, similar policies go through. And the stronger the collective, the more impact you can see. And to be fair to the government and the particular line ministries, they actually have a very open door policy. So they are prepared to listen to us. That's always been that's one thing which is very encouraging. It takes a bit longer for you to see the impact of those policies, because again, like I say, implementation really has always been a big problem for us here. So we don't have strong enough institutions as a country. I think that impacts the extent to which we're able to implement the policies that we develop.
Interesting. Strong enough institutions. Very strong advocacy drive. You have a wonderful relationship with line ministries. Allow me to ask this question. How affected is this wonderful relationship by politics? Because sometimes, you find people always talking about do not politicize this, do not politicize that. However, politics does, tend to creep in here and there.
I think, so in my view, politics, we tend to see it as an abstract issue, but I think everything we talk about on every single day is about politics. When we discuss the price of milk or the price of fuel, that's politics. That conversation is political. If you mean to what extent do we find ourselves engaging in, shall we say, high-level political conversations, we are apolitical. We do not subscribe to a particular ideology or whichever of any political party. What we look for is what is happening on the ground, what is the evidence saying? And we then use that evidence to advocate to the powers that be, regardless of who is in power at that particular point in time. That is our mandate. We want to, as I say, implement or at least contribute to the development of pro-poor policies. So we distance ourselves very much so from engaging in these high-level partisan conversations. We speak to our research, the evidence, and that's what we use. And if the evidence is against, say, government policies, we will say, we don't agree with this because on the ground we have found this. That gives us credibility, I think.
And how has that affected then, or improved, your relationship with government itself?
It hasn't. It has not been detrimental. I think because we speak the truth.
Right. Well, the truth hurts, so I have heard.
So I'll give you an example. We've been very vocal. We always have been about, say, what we now have calling a debt crisis. We spoke even before we reached this level that our borrowing was becoming unsustainable. We spoke, and then sure enough, it happened that we reached the level of unsustainable debt. And we've been consistent, and we've been honest, and our evidence has not been contradicted. Everything we've been able to tell the government has actually come to pass. And that, like I said, just gives you credibility. And it's not we don't speak from a place of trying to criticize, but inform. So it hasn't been detrimental to our relationship with the government at all. I think there's an aspect of mutual respect,
Right.
if anything.
So now, and you've correctly said, this is just, under a year that the National Health Insurance Scheme has been law. And we're getting into a more politically charged environment where spending will, in the eyes of some, be seen to be more prioritized towards political issues, because some people want to get into office, others want to stay, and there are issues to do with elections and so on and so forth. How far do you think, again, that this will impact on the implementation of the National Health Insurance Scheme?
It shouldn't. It really actually shouldn't, because the law has created a particular institution to manage this. So really, regardless of what is happening there, whether it's campaigning or whatever the case may be, that shouldn't impact the National Health Insurance Scheme and how that is then operated.
Ideally, it shouldn't.
Ideally, it shouldn't, no, because you've created a system which the law has provided for. So it really, really shouldn't. I think I'd be loath to think that the monies which we're remitting towards for our healthcare would somehow find itself being used for campaigns. I'd be loath to think that could possibly happen. So as it is, the NEMA has autonomy to manage the fund in a particular way, and as long as that is done, it really shouldn't matter whether your people are campaigning or whatever the case may be. It shouldn't be affected. We should still be able to have our access to healthcare.
I bring that up based on what you said earlier regarding toll fees. Yes, you're remitting, you're paying, and yet, because you're not told, you're skeptical about, wait a minute, how is this money even being used? Because I see a pothole here, and now there are two, and so on and so forth. And you want to think that the particular institution managing that is autonomous. And there are all these suspicions surrounding these things because of the lack of information being publicized. I don't want to stray you into those waters, because I don't think that that's a good thing or the right thing to do. But there's an essential package for the care needs of children, and they're supported by a set of norms and standards. Ideally, everything that is written down as policy, perhaps even law, should be followed to the latter. But we see that the contrary is very true in some cases. Let's talk about the aspect of infrastructure. We talk about the issue of equipment and medicines. You did say earlier that this is now, the principle of it is that you should have access to proper infrastructure equipment and medicines. But then again, the reality is that this is not, the reality on the ground. So if I have had my employer and also myself remitting 1%, so 2% of my income to government since January, I fall sick or my child, and I go to a health facility and they do not provide the necessary medicines, what is there for me to demand this by law?
So, and again, I speak with caution because we have not seen a large time of implementation.
Absolutely.
And we are yet to receive any information from NEMA. And to be fair, it's been less than a year.
Yeah.
So by law, we're supposed to receive this information in any case. And you have a right to query, whether it's publicly, whichever the case may be, to say, well, look, I went to the hospital, there was no Panadol, there was no this, there was no that. Where is our money going? Have we reached a stage already where we should be asking those questions? Where is our money going? No. I think we need to, right now we're playing a waiting game. We need to see exactly what happens in the next, shall we say, 6 months or so.
Okay.
By then we should have an indication as to say, okay, well, we've been remitting funds for the last, I don't know how long this has been now. Where has the money been going? Can we see the report? Whatever the case may be. We should see another report from Auditor General, I think in the next few months or so, for this particular financial year. Hopefully in there also we may be able to have an understanding of where our monies are going. One thing I will say is that the earlier this year, I think it was in November, the Auditor General's Office published an interim audit report to do with the COVID funding. That was very encouraging in the sense that it shows commitment on the part of that particular institution to properly investigate public revenues. And the NHIS, or those monies, are also part of the public revenue. So they are not outside the realm or the reach of Auditor General's report. So we're encouraged by that. We would like to see more of that, such queries or interim reports that question how revenues are being allocated or spent. I'd like to believe that even that has put an element of, if you want to say, fear into NEMA to say we need to be compliant, we need to stick to what the law says. So hopefully in the next few months or so we'll be able to see some sort of concrete feedback as to how this has been implemented, what has happened, where have the monies gone, how much was collected, what are the priority areas. All of that information.
Okay, so you've given a projection of around 6 months before we can begin to, look at, okay, is this going in the right direction, is it not? But also from a research and policy analysis perspective, when do you think that this would be, properly operationalized countrywide?
2 years.
2 years.
So we've had about a year, and of course within the year, again, we've had quite a few hiccups with COVID and all of this.
Yeah.
And then going into an election, which shouldn't matter, as I said, that shouldn't really make a difference. So I would like to believe that by the end of 2021, we would have a fully operational national health insurance scheme.
And it's only then, perhaps, that we should begin to even have conversations around, can I, actually find Panadol?
Exactly, exactly.
Okay. There are issues to do with partnerships.
Oh, by the way, that was just an educated guess, not that.
An educated guess of yours is not
exactly.
research informed.
No.
Okay. You work, as civil society with, different organizations, and you did bring out the aspect that, well, let me put it this way, the more we are, the stronger we are, the better we can be heard, and so on and so forth. Has that worked, though?
Yes, it has. I think that when two voices are better than one, louder than one, two heads are more efficient and more effective than one. So we found that when CSOs form a coalition on particular issues, there is much more, I guess it's more of a mass movement than anything. And we find that there tends to be more, the more inclined to listen to the powers that be when that happens. So yes, there's power in partnerships, absolutely.
So for 3 years you've been, working on projects that are focusing on public investment in children. What would you say have been some of the major scores and or challenges over the last 3 years?
I'd have to say it's been more challenging than anything. Again, just being able to find or get information and tracking revenue. So we have Control 99, and it was felt that a centralized pool is easier to manage than having monies in particular sectors.
Okay.
I don't agree with that personally, because I think that, I know that administratively it's difficult when you decentralize, but I feel as though once monies go into a central pool, it's like a black hole.
Yeah.
It's difficult to then track, okay, did this go where it should go, did this go where it should go? So I think that that's been one challenge. The opportunity, though, is that we've been able to identify these weaknesses and put them into policy briefs and policy recommendations.
Right.
So we have made recommendations to government about what we think could be done to improve, whether it's tracking, improve accountability and transparency with respect to public expenditure for children's needs.
Has this tracking been difficult because of lack of documentation from the point of filing systems and things like that, or it's been, as you've said, the aspect of a black hole? And I know that those in aerospace will talk about how a black hole is this thing that sucks in planets, and well, it's a dark hole, and you absolutely get lost when you go there. But even in terms of digitalizing filing systems, what sort of challenge have you faced in this regard? Because we're a highly digitalized, or we should be a highly digitalized generation by now. Have you had any difficulties from the point of view of just the filing systems as well?
Yeah, absolutely. I think, as you say, we are a highly digitalized generation, but let's be honest in that where we are as a country is not where other countries or in your Western or more developed countries are. I think that one of the disadvantages we have as well, let me speak for Zambia, is the fact that I think we are so far behind technology. And technology is the new equalizer, they like to say. But we forget that there are a number of infrastructure gaps that keep us away from attaining that. So, and that is, it transcends even to our public systems. We know that even, for example, ZRA is trying to go more digital for the sake of better compliance, better administration. So definitely filing is one of the challenges, and just being able to trace or track documentation. We definitely need a better document or data management system across the board in all public sectors, I think. That is definitely something which needs to be looked at. And yes, we've noticed that weaknesses as well. And I think that we've seen several or one or two projects from donors that are linked or that are targeted specifically at dealing with issues around digitizing the public systems. So yes, that has been a challenge. I think that there's definitely commitment to improving or addressing that. But it does, of course, then mean that it makes it a bit harder to gather information.
Okay, so if you just joined us, this is a special interview with CTPD. CTPD is Center for Trade Policy and Development. Did I get that right?
That's correct.
Okay, I'm talking to Head of Research and Legal. This is researcher Chilesha Mange. We've been discussing over the last, 45 minutes, close to an hour or so, about the sensitivity of the National Health Insurance Scheme towards the health needs of children. Now, the issue of Center for Trade Policy and Development is very much research-based, and your think tank of very competent people in various areas. Just for the sake of somebody who's just joined us, I'd just like you to speak to again what CTPD really focuses on majorly.
Okay, So, um, in terms of research, we operate in 4 main areas, or we have 4 desks. So we have the extractives desk, which of course is the mining sector. The mining sector, of course, being our economic mainstay. We have the trade desk, which looks at issues around development and trade, and also agriculture, which is one of the core areas that it deals with there. We have public finance, which looks at issues around how public resources are being managed and how that is being addressed. And then the legal desk, which looks at various issues around legislative reform and so forth. Those are the 4 main areas that we are divided into. So basically that means that we cut across almost all areas of the economy, or all the different sectors, finance, commerce, extractives, you name it. That's how we operate. And as I said earlier, we either respond to particular issues or we predetermine what areas we want to interrogate or tweak.
Now, bearing in mind the aspect of the National Health Insurance Scheme, how far, I don't know if you've actually done deliberate research around this particular area, how far behind or ahead are we in the issue of R&D in the health sector? Based on, how much research are we doing in the health sector, how much development has there been, looking at, for example, Vision 2030 and so on and so forth. We did have the MDGs and so on.
And sustainable development goals and all of that.
Yeah.
I think that, public health is it's very complex. And you find that within the public health system, you will be targeting very specific issues. Last time I came here, we talked a lot about tobacco.
Tobacco, yes.
Today we're talking about National Health Insurance Scheme. So it all really depends. If you look at particular sectors or particular issues within the public health system that have to be addressed, it's very wide and very complex. I think that, at least as CTPD, we've done quite a bit in terms of trying to, on particular issues, identify what we think are developmental issues as well within public health. Tobacco is about development, and so is child health needs. That's why we spoke particularly. That's why we particularly were responsive to those particular issues. So I don't want to speak for Ministry of Health and say this is how well they're doing and this is how they're not doing. I can only say that as CTPD, like I say, we identify particular issues, and those are the ones that we have chosen to address. Is there enough research in Zambian context? I wouldn't know.
Again, it's a tricky question because even the information isn't as readily available, perhaps.
And I mean, I have worked with a lot of Ministry of Health individuals and people, and I've come across a lot of competent individuals who know what they're doing and who are very responsive to the issues around public health management and so forth.
Okay.
Could we strengthen research? There's always need for better research. I think research informs. That's why you find your best corporations are those that have, proper research and development units. Ask Nokia what happened to them.
Okay. We did see that towards the cold season, I don't know if we should call it winter, we were peaking in terms of, COVID-19 infections. And this pretty much has, died down. There aren't as much, new infections. We don't even have the updates daily now. So this is an indication that, we're good, pretty much. Yeah, pretty much. But do you think that going forward, remnants of COVID-19 may affect the aspect of implementation of the National Health Insurance Scheme?
I think one thing we need to be wary of is sort of declaring ourselves COVID-free. I'm not a clinician, and I cannot speak to the progression of the disease and so forth. We have seen that the rest of the world is facing the threat of what they call a second wave and so forth. What we need to be wary of as Zambia is the economic impact of COVID and how that then affects our interface with the rest of the world, or that interaction with the rest of the world. The National Health Insurance Scheme is a local issue. It's a local, a domestic issue. It's a domestic initiative. monies are coming from domestic revenues, really. So my view is that regardless of what happens, the implementation thereof should not be affected. If we say that, well, a lot of monies will go towards then addressing COVID issues, that's understandable. But the fact remains that there should be accountability and transparency in how those funds have been collected, how those funds have then been used. Again, with the overall aim of improving our healthcare and universal access to health.
Okay. Now, going forward, even as we're winding down to the end of the program, what other, concerns or issues do you feel needs to be discussed pertinent to the National Health Insurance Scheme?
As I say, at this point, really it's more of a wait and see. And as I said, as CSO, we are particularly interested in seeing the implementation and as it goes forward. Would like to see more institutions being accredited. Would like to go on the ground very soon and hear from the masses what the experiences have been with the National Health Insurance Scheme implementation. So, for instance, we'd want to know from the public, and of course, and this is will be part of a separate study.
Okay.
When you have gone to access your health care or whatever it is at these particular institutions, what has been your experience? So these are all subject to a different conversation a bit later. So for now, really, it's more of we're watching to see where this goes and what happens.
Watching. Is there a particular time frame to the expiry of your watching?
No, we're always watching. As long as an issue affects the public and it affects economic growth and development, we will be on it.
Okay. Well, I would like to thank you for spending time
Absolutely.
with us, lay persons, on this particular matter, and just bringing out aspects to do with the National Health Insurance Scheme, which a lot of people may not even be aware about in terms, yes, as it's being law. So until the next, I don't know. Last time we talked, you were talking about tobacco, and now the National Health Insurance Scheme. It looks like, a huge deviation. I don't know what we'll be discussing the next time you and I talk. But yeah, so thank you also for watching. If you have just joined us, well, you've joined us at the tail end of a very, for me, I think, informative discussion that I have had with Chelesha Mange, and she is the head of research and legal at CTPD, and we've been discussing the sensitivity of the National Health Insurance Scheme to child health needs. Thank you, and I hope you enjoy the rest of the festive season.
I will. Thank you so much.
Any New Year resolutions? I know a lot of people during this period would like to talk about, things that they want to do.
You know what? It's been such an unprecedented year. I think I just wish everyone health and stay alive, really. I think we're fortunate enough to be breathing at this point in time. I mean, we've lost so many loved ones, so many people. It's been a difficult year. So all I want for next year is just be able to wake up without this anxiety that, I may go out and catch some sort of disease that no one has ever heard of. So, yeah, I think just to everybody we wish, from CTPD, we wish you all health and prosperity. Okay.
If you are an employer, ensure that, you're compliant with the issue of, the National Health Insurance Scheme. If you're an employee, tell your employer to comply, but do so yourself as well. My name is Carl Sambaso. Thank you very much, and we'll see you. Bye-bye.